Thank you very much, Declan, for a lovely introduction, and thank you very much to Tom and Valerie and the TMRN for the invite. And I can't really go any further without saying thanks a million to the TMRN for the support and the funding for various things that I received during my PhD, and I can't not mention Sandra Galvin, who was just personally a huge support to myself during my PhD. And the TMRN is a great network, and I'm really glad to see some familiar faces here and to kind of connect with a couple of you earlier on. So it's lovely to be here. So I started my professional journey, I suppose, as a radiation therapist, which, if you don't know, is an allied health professional. And I worked in clinical trials for a number of years, I think seven and a half years. So I wrote a lot of participant information leaflets, and I talked to recruited hundreds of patients onto various oncology clinical trials. And I then worked for Cancer Trials Ireland for a couple of years. So again, was looking at a lot of participant information leaflets, and then started the PhD on the topic of informed consent. So it's something I feel really quite strongly about. I think it's really important, and really glad to speak about this today. So this is an overview. I'm going to talk about two things today. If there's anyone in the room who is not convinced that it's important to have good, effective, clearly written trial PILs, then I hope that I will manage to convince you. And I'd also like to give my top tips on designing effective trial PILs. I say top tips because anyone who knows me will realise I could probably talk about this for the full 2 days, but I have a 25-minute slot, and actually, Declan, you might give me a wave a few minutes towards the end because I tend to go on a little bit. So these are my top tips. If there's anyone in here today who doesn't write trial PILs or study PILs, well, you might write plain English summaries for grant applications or for reports or maybe for academic publications. Really, the same principles apply across the board. So hopefully there's something for everyone to take away. I'm going to try and focus in on, I suppose, tips that I think any of us can use, any of us can action, depending on, regardless of how much budget we have to make fancy videos or websites or anything like that, and try to go back to the basics. What can we all do to write more clearly, and more directly, and more effectively to trial participants? So, why is it important to have good trial PILs? When I started the PhD on informed consent and started to go on and on about writing good trial PILs, a lot of people said to me, "Really, Lydia, now it's not really all that important what you write in an information leaflet, because what the trialist or the researcher or the research nurse or whoever says to the participant is way more important. Really, they don't read information leaflets." And I heard that a lot. I would question that. I spoke to, as I said, hundreds of people over the years, and I would always ask our participant before they sign the consent form, have you read the PIL? Now, a lot of investigators don't necessarily do that. It's the role of someone else to do that. If the participant said no, and by and large they usually said, yes, I have read it, and my daughter's read it, and my niece has read it, etc., and my next door neighbour sometimes, or whatever. But if they said they hadn't read it, well, it was my job to read it to them, or maybe not word for word, but to go through it. So anecdotally, I have found myself, the information leaflet is really important. We know from studies that both in the clinical setting and in the research setting, that adding written information to verbal information, just speaking to the person, improves how much they remember and how much they understand when we test them afterwards. So the PIL must be doing something, I suppose. It must have some kind of a role. The other thing that I think is quite important is that, as I mentioned, consent doesn't generally happen in a vacuum with just this one person, the researcher, and the participant. The role of community is hugely important. And we saw this a lot during COVID, where only the patient was allowed to go to a hospital appointment, or maybe just one other person. And then that person goes home and is trying to remember all of the things that the healthcare professional spoke to them about, or maybe the trial person. And it's very, very difficult. I had this issue myself during COVID with family members who were going for hospital appointments. It's a lot of pressure on a research participant to remember everything that the doctor has said and the nurse has said and the allied health professional, and then to remember all the stuff the trial person has said to them. It's very difficult. It's impossible. So good quality written information is very, very important. I will move on to the next slide. I suppose this cartoon is trying to get across the idea that since the beginning of the requirement coming in that we must give written information to trial participants, which was a good thing, of course, our PILs have got longer and longer and more complicated. I think the longest one that I've ever seen was 58 pages long. So 26 actually pages wouldn't be too bad. Very densely packed information, very complicated, lots of gobbledygook. And I feel quite strongly that our research participants who give of their time, they allow us to take blood samples, they do these long questionnaires asking about this, that and the other. We ask them very personal questions about side effects to various treatments. They deserve better than 58 pages of absolute gobbledygook. So I feel quite strongly we should do whatever we can to try and make the written information we give to participants, who then take that home to their families and their support system, and try and make it as clear and accessible as we possibly can. So I think I've made it hopefully fairly clear that we have some kind of ethical imperative. A participant can't give their informed consent unless they've understood. We know that there are legal requirements, that we have GCP, we have the World Health Organization who have guidelines and instructions on the fact that we must give participants written information, that it should be clear, it should be concise, etc. But I suppose it's quite important as well to point out that 1 in 6 people in Ireland have literacy challenges, and that means that they may be unable to understand basic written information, and that's the extreme end of the scale. You also have a reasonable proportion of people who may not have, they may be able to read, may be able to understand a fair amount, but they really have challenges, particularly accessing, understanding and applying health information. From a numeracy perspective, 1 in 4 have trouble doing simple maths, but we often have in our PIL ratios and percentages, and a lot of that is attached to information about risk and side effects, and that's a concern. There have been a load of systematic reviews looking at how well participants have understood information about a trial. Now, some of the settings are kind of hypothetical, some of them are actually done in actual trial participants. But they're fairly clear and consistent in saying that participants very often have a concerning level of understanding about key concepts. So Piotrkowski, apologies, I said that completely, pronounced that totally wrong, but anyway, they did a systematic review of empirical studies that looked at level of participant comprehension of really important aspects of a trial, and they found very concerning low levels of understanding around the placebo, randomization, risks, side effects. How can someone give their informed consent for a trial if they haven't understood the level of risk involved? Or indeed, if they haven't understood that they will be randomly assigned to one of 2 or more treatment arms? Well, they can't, is the answer to that. So I hope I've persuaded you that it's important to have good trial PILs. But if there are any doubters still in the room, I did a study during my PhD where I looked at 154 PILs. They'd been approved by research ethics committees in Ireland and the UK. None of them had the reading age that was recommended, which is 11 to 12 years, recommended by the American Medical Association. A lot of them would mean that a participant needs university education to understand them. Most of them didn't use any diagrams or infographics or even a picture of any kind, which is recommended by health literacy organisations to try and improve comprehension. And only 2 were in line with guidelines published by NALA, the National Adult Literacy Agency in Plain English UK. Now, these guidelines are not wildly complicated or wildly unachievable, but yet only 2 were in line with them. So it's quite disappointing, and I really think this shows we can do better. So, moving on to my top tips. So the first thing, who are you writing your PIL for? And I'm guessing there's kind of a mixed audience here. Some of you might be writing PILs for like a healthcare professional kind of audience. You might be doing, for example, a couple of weeks ago, I took part in a focus group on preparing evidence summaries. So everyone in the group, we were all kind of research kind of background. We all did evidence synthesis for a living. So the participant information, even, I mean, I think I scanned it in 30 seconds and signed it and sent it back. Really wasn't a massive big deal. But if you consider that a lot of you in the room are working with lay people, people who are sick, who are vulnerable, maybe have had a range of other treatment before they ever come through your door, it's quite different. It's quite a different situation. So my first point is, depending on who you're writing your PIL for, you need to think, who is my audience? Who am I aiming at? First tip, use plain and simple English. I've discovered over the years that people have wildly different ideas about what constitutes plain English. So I will start off with what plain English is not. Plain English is not sloppy. It's not grammatically incorrect. It's not imprecise or inaccurate language. It's direct, simple language. I was reading on the Lewis this morning that it's recommended, and in fact this actually happens, that within the airline industry, so for pilots and I guess flight attendants and whatever, the manuals they're given and the instructions and stuff are all, there's a requirement they're written in plain English. Anyone want to take a wild guess why that might be the case?
In case a passenger had to fly the plane.
I didn't even think of that, but yeah. Yes? Anyone else? What could happen in a plane?
Safety.
Safety, exactly. Because funnily enough, in times of stress, if language is clear and direct and simple, people will understand it and less mistakes will be made. So, first tip, please use simple and plain English. NALA, who work with people with literacy challenges all the time, have set out these plain English tips. The UK have similar ones, Australia have similar ones, America have similar ones. They all say more or less the same thing. Please look at these tips. They have a one for documents, one for consent forms, and they also have a checklist. Please have a look at these, and a lot of things I'm talking about today are things that they say in their plain English tips. They're really, really, really good and very, very clear and very, very actionable. If you are really serious about wanting to write, and you're writing a lot of participant information, NALA do a very good one-day training course. I've done it twice and it's very, very good, and really challenges you on a practical level of how can I write in simple plain English. If you don't know where to start, and Declan is kind of right when he said people email me with PILs, and actually I don't mind that. The first advice I would give, and the first thing that I always start with when I'm sent a PIL that I read and go, could be a little bit better. The first thing I always start with is the verbs. So try and make your verbs simple and direct. Your participant information leaflet is not an academic paper, and it is not a trial protocol, although I have to say I prefer academic papers that are simpler and written more directly. But anyway, that's a topic for another day. But try to use words like take part rather than participate, ask rather than request, get rather than receive, etc., etc. So start with your verbs. Quite often if you get your information leaflet and you change around your verbs, it kind of changes the way you think about your information and the way you're writing. Definitely, please get rid of the jargon. The number of PILs I've seen that have had adverse events in. Now, I did not understand what an adverse event was until I started working in trials. And participants don't. They want to see side effects. If you absolutely have to use a complicated word, some kind of jargon, for example, if you're working in oncology, it might be important that you use the word neutropenia, for example. Explain what you mean by neutropenia is and explain what it means for the participant. So saying someone's white blood cells may be low, yeah, that's what the word means, but it doesn't necessarily mean anything to a layperson. Avoid dead weight words. Dead weight words are words that really don't add anything to a sentence. They're kind of put in kind of to make the sentence look flowery or sound more impressive, but they don't add anything. They're usually adverbs, by the way. This is not a grammar lesson, but they're usually adverbs. They're usually a word that describes a verb. So the most common example of this is, your participation is entirely voluntary. Now, either someone's participation is voluntary or it is not voluntary. It can't be more or less voluntary. So saying someone's participation is entirely voluntary really doesn't make sense. Just say you don't have to take part if you don't want to. Now, bear in mind, when you're speaking to someone, you might, and I have said this hundreds of times over the years, you absolutely don't have to take part. It's completely up to yourself. No one will be upset with you if you decide you don't want to. And that's fine when you're verbally speaking to someone, but when you're writing, you shouldn't be writing the way you speak to someone. What happens if that happens, if you do that, your PIL gets longer and longer and longer and has all these filler kind of words like entirely voluntary that you don't need, and it makes it very frustrating for someone who's trying to extract what you're trying to say. Try and avoid repetition. This happens particularly in the introduction and the procedures section. When you're giving written information, you only need to say something once. Now, when you're speaking to a patient, of course, you may say things there may be things that you say twice, especially safety things or when is their next appointment or what do they have to do. But when you're writing, it only needs to be put in once. And I mentioned the issue with people have maybe struggle with numeracy. Please don't use ratios. For example, you'll be randomized in 1-to-1 ratio. I mean, that doesn't necessarily mean anything to our participants. Or try not to use percentages by themselves. So if you can say 1 in 2 people rather than 50%, just try to do that. Think about what a participant would want to know, not what you would want to know if you were on the trial, because you work in trials. Not what a clinician would want to know or a scientist. Please try and keep the sciencey stuff to a minimum. This happens a lot in, those trials where you have an intervention, but then they're also collecting blood samples or tissue samples, and there's this long spiel about the immune system and how all the bits in the immune system work. If a participant had wanted to know how the immune system works, they would have read a textbook or watched a YouTube video or done a science degree or whatever. So this is not the purpose of the PIL. Try and pare it back to what information do they need to know to make a decision. Try to think about what an average person would want to know, not what a specialist in the area would want to know if they were on the trial. The specialist in the area, if they wanted to join your trial, they'd be able to find that information because they know where to look for it. And they would know probably lots of people who they can ask questions to. So try and keep sciencey stuff to a minimum. Just really important to say, and I mentioned this before, plain English is not incorrect, inaccurate information. It is really important, of course, that the information you give is clinically and factually accurate. If you are writing a PIL and you're not a specialist in that area, you obviously need to get whoever the appropriate clinical person is to read it and check that the information you're given is accurate. Sometimes when we simplify something, we do lose some of the nuances. Obviously, for safety reasons, the information needs to be correct. So please do check that. And especially if you're doing some kind of a multidisciplinary trial, some of the complex interventions, you have multiple disciplines involved, please make sure you get the relevant person to read the information and check it's correct. Try and avoid long sentences. This is an example. I've slightly de-anonymized it slightly, but actually the PI on this trial is a very good sport, so I actually don't think she'd mind. So I think this sentence is something like 58 words long. It's quite long, isn't it? And I guess I have a doubt in my mind that a participant will be interested in knowing that these researchers have very important scientific efforts. They probably don't want to know that. So try and reduce the length of your sentences. Now that doesn't mean that all your sentences need to be really short, because if you write like that, it comes across very terse. But I think we're all taught, when we're doing academic writing or at some point in our careers or training, that it's good to have a mixture of short and long sentences. It helps the document to flow a bit better. But your average sentence should be somewhere between 15 and 20 words. Now, you do not need to go and check all the sentences in your document. Sometimes I do that if I'm writing a plain English summary, or if I'm just writing in general and I'm thinking of that sentence looking a little bit long. But actually Microsoft Word will tell you, if you can set it up using the spell check function, there's a few boxes you can tick. You can Google it, it's very easy to do. You can set it up to tell you, after you do a spell check, what your average sentence length is. So if you're finding that your average sentence length is more than 20 words, you need to go back in your document, see which sentences are the really long ones, and try and reduce them down. Try not to use too much passive voice. It's funny, I think when I did my undergraduate training, we were kind of recommended that, active voice sounds too informal and we should use passive voice. But actually, the advice when I was doing my PhD in the Writing Centre is that academic writing actually should use active voice. But I have found trial PILs have lots and lots of passive voice. So, no, I'm not a Star Wars fan. This is Star Wars, right?
Obviously.
But I think Darth Vader is the bad guy, and it's Yoda, right? Yoda is the good guy, yeah? So when we're writing PILs, we need to think, how does Darth Vader, I know it's a bit counterintuitive, we need to think about how does Darth Vader communicate? I find your lack of faith disturbing. Direct, to the point. Follows the subject, verb, object kind of syntax, okay? As opposed to powerful, you have become the dark side I sense in you. So let's try and not be like Yoda. Let's try and be like Darth Vader and be clear and direct. The problem with passive voice, personally I find it a little bit irritating to read. The problem with passive voice is you don't get directly to the point. So the person has to read the sentence multiple times to try and figure out what you're saying. It happens a lot in academic writing. I think it's kind of slightly forgivable there, but it's not forgivable in participant information, I don't think. So an example from a trial PIL. You will be asked to fast. You will be asked to give a blood sample. You can just say, we will ask, put in a personal pronoun, which we'll get to. You can just say, we will ask you to fast. We will ask you to give a blood sample. Now, there are some situations in a trial PIL where passive voice might be appropriate. It might be necessary not to be too specific about who does what. I don't know if anyone has any suggestions as to where in a PIL you might need to use passive voice. There's obviously no lawyers in the room. Sometimes in the legal section, what your legal department will give you and tell you have to put in tends to be a lot of passive voice. You may not win the battle with them to change it around to active voice. I have generally lost that battle over the years. So sometimes you will have to use passive voice. But in the situations where you have a choice and you have the opportunity, change it so it's direct and it's active voice. Again, Microsoft Word will calculate this for you, and you're aiming for no more than 20% passive verbs. So set yourself up with Microsoft Word, and it will tell you when you go over. Use personal pronouns. There's nothing wrong with using I, we. We invite you to take part in a clinical trial. We will ask you to take part in a consent form. There's nothing wrong with that. Use personal pronouns. Now, layout. Let's talk about layout for a minute. Layout is really important. I know you may not always have a huge amount of flexibility because your sponsor or your ethics committee may have given you a template and told you you have to follow this. You might get away with it. I found that I've gotten away with it a little bit over the years. If you keep the headings, but then you change the word spacing and the font size and what the font is. So play around with it a little bit. And if anyone in the room has the opportunity to be writing templates and setting up templates, please take these kind of things into consideration. Ooh. So, use a picture or infographic. This is really important, especially for dyslexic readers, people who are neurodiverse. This is a really good example used with permission from Queen Mary University in London. So you can see there's 2 arms on the study, but there's actually 4 products involved. So red blood cells, plasma, platelets, and cryoprecipitate. And you can see, obviously everyone in this room is involved in trials in some way. You can see the importance of communicating that there's 2 stages, and even if someone is randomized to standard of care arm, their bleeding does not stop what the appropriate intervention is. It's really important with a diagram or a picture. It should support the main message of your PIL or a difficult concept, rather than just sticking them in just kind of for the sake of it to make it look more colourful or whatever. And also these, if you don't have a colour printer, you can do these in black and white. You used to be a little bit more clever with your grayscale and stuff, but they're relatively easy to do. Definitely think about it. Communicating risks. So risks and side effects, as I mentioned before, like randomization, is one of the areas that participants find particularly difficult. You can consider using stick figures or a very simple schematic to communicate risk. I know if you're on, some people in the room work on oncology trials, and they generally have a long risk section, and it can be quite difficult. So do what you can. If your trial is relatively simple and there aren't that many risks or side effects, definitely consider using something like stick figures. If you do use photographs, you are using photographs, and you might want to, depending on what you're doing, try to think about relevance and also diversity. So if your trial is age 18 to whatever, 99, you should have a range of ages in your photographs. The reason I have a picture of a toothpaste model here on my screen is that when I was designing a leaflet and a website and a video during my PhD, the graphic designer kept coming up with these pictures that look like toothpaste models. Yeah. So try and have a bit of diversity with age, ethnicity, and things like that. And try and avoid, if possible, if you have a choice. I know sometimes you have to pay for these images, you may not have a choice, but try your best to think about how relevant something is and diversity and that. Use bullet points. Bullet points are definitely your friends, especially in the side effects section or in the studies procedure section. Try to use bullet points. Ideally no more than kind of 5 to 7. If you've got loads, put in a subheading. Group them into very common, not so common, or maybe area of the body. So general, ones that affect the digestive system, etc. like that. Font. Try and use a sans serif font like Arial, Verdana, or Tahoma. Try and avoid Times New Roman. We know from studies with dyslexic neurodiverse people that they find it much more difficult to read a sans serif font. Don't use running capitals. Try to use bold rather than underlining. Again, people with dyslexic readers find it difficult to distinguish one word from another if you have them underlined. Try to use a minimum font size of 12. If you can't use 12, use 11.5. If you can't use 11.5, use 11. I've seen so many PLs that have a font size of 9, and I don't know who they think can read them, but try not to use really small writing. Try to use 1.5 spacing if you can, or if you can't use 1.5, use 1.25. Do what you can to try and increase the amount of white space. Please don't copy the trial protocol. This is an example from a real PIL. EOS is end of study, by the way, in case anyone doesn't know. IMP is investigational medicinal product. Try not to use things like this. If you can use a video, website, or an app, try to. Your university might have more options available to you than you think. People make videos themselves on their phones. A very simple video from a PI can be really, really helpful. So consider it. We don't know an awful lot about the effectiveness and the effect of how they help people understand better, but definitely think about it if you can. So, in summary, think about your audience, ditch the jargon, write in simple English, don't use too many long sentences or passive voice, try and use personal pronouns. Try and test out your PILs on any willing victims you can find, family, friends, next door neighbour, someone who doesn't know about your area. And thank you for listening, and if anyone wants to send me a PL to look at, I really don't mind. I'm a glutton for punishment, Declan.